Hey everyone, in this video we're going to be covering the bony landmarks of the pelvis, the femur, tibia, fibula, and everything that's just lower of the body, the inferior part of the body. So let's go ahead and dive right in. On your pelvis, you have three main parts that we want to talk about. We have what's called your ilium, and don't get that confused with the ilium in your small intestine. That section, there's just a letter difference, and it can get kind of confusing. So be aware of that. And then we have our pubis, and then we have our ischium. Those are the three main parts of the pelvis that you really need to know. Let's change this up a little bit right here. You can kind of see these pieces. So you have your SI joint that sits in right in here. This is your SI joint, stands for your sacroilium joint, the SI joint. Some people have problems with that. Then you have the top of the ilium, or your iliac crest. Then this is what's called your anterior superior iliac spine. And then this is going to be your anterior inferior iliac spine. So if we come back to this one in green, some people refer to it as your ASIS, and the one just inferior to that as your AIIS, as I've actually heard it that way before. But looking at your pubis, which is right here, you have your pubic tubercle, and then some people will call this section right here your pubic crest. Looking at the posterior side of your ischium, which is down in here, this is what's called your ischial tuberosity. That's another major landmark right in there. The holes of the pelvis right here, this is going to be your obturator foramen. You have muscles that attach on this inside and on the outside. Let's see if I can show you here. Yeah, so here's muscle attachment for obturator externus sitting on the external side. But if we look inside that pelvic inlet, there is the obturator internus attachment site. Let's come back to this. Let's look at the femur. I'll go ahead and isolate this. So here's the femur. Pretty distinguishable among other bones, just with how big it is. This section up here is the head of the femur. This is the neck of the femur. And then sitting kind of like the humerus, you got that bump sitting on the lateral side, except this is called your greater trochanter, whereas on this side right here, this is your lesser trochanter. You've got like hip abductors that attach to this, whereas your hip flexors attach to that lesser tubercle. And you can see what I'm talking about, that greater trochanter right there in pink, while the lesser trochanter is now in pink. There's the neck of the femur. There's your shaft. Some people call it that. And then you've got your epicondyles sitting right up in here. And then if you come down lower, you'll hear it called just your condyles. So your epicondyles sitting up here, and then condyles of the femur, you have a medial and a lateral. I wanted to cover these while we're here, part of the knee joint. So you have this bone right here, which is your patella. And inferior to that, that's going to be your patellar ligament. Okay. Let's go ahead and get rid of this so we can actually see in here. So we're looking at the anterior side because this is the patella. We look at the posterior side, we're seeing these. Um, Coming back to the anterior side, we can see the meniscus. It's a cushion where your femur and then your tibia come together. And this is known as your tibia, where the meniscus sit is what's called your tibial plateau. And then we see this ligament coming in to this front side right here. That's going to be your ACL, or your anterior cruciate ligament. If we rotate this back, as we got that selected, I'll show you that it's going to come from the lateral side, right? You're seeing what I'm seeing. It connects onto that lateral condyle and comes right to the middle up front on that tibial plateau. As for the PCL, or your posterior cruciate ligament, looks like it's pretty much like it's thicker, but it's connecting to the medial condyle and then connects into the back of that tibial plateau. Here's that meniscus again, so you can just see it. If we get rid of this femur, now you can kind of see this joint right here. So meniscus, that's where it articulates with that femur on those condyles. Posterior cruciate ligament, anterior cruciate ligament. Now let's look at this other knee. Oh, lost it. Sorry. Come down. There we go. So, looking at this leg, we're going to look at the lateral side. There is our fibular collateral ligament because it's connecting into what's called the fibula. You might have heard of this as called your LCL because it is your lateral collateral ligament. Same thing. Then we have our tibial collateral ligament, which is on the medial side, or you might know it as your MCL, your medial collateral ligament. All right, continuing to move on. This is the tibia. There's no L in it. I have the biggest problem trying to put an L in tibia, and it's part of the reason is because the fibula has the L. So, best way I can remember this is tibia is up front and fibula, it lies. It wants to be up front, but it's on the lateral side. It's got that L in there that lies, and it is lateral. So that's how you keep that straight. Just like the radius in the ulna and the antebrachium, there is an interosseous membrane that sits in there. Okay. And it comes all the way down, and then we have this part of your leg. You know this as your ankle. It's your lateral malleolus, and that's coming from the fibula, while your medial malleolus comes off of the tibia. All right. Looking at the feet right here, we have the calcaneus. The biggest weight-bearing bone in your foot that holds up your body weight is this talus bone right here. You've got this cartilage that sits in there that articulates with that bone. There's your talus. When it comes to your feet, you've got it's a similar structure to your wrist. So in the wrist, we talked about having carpals and then metacarpals. in your feet, it's called tarsals. So you have tarsals and then you have metatarsals. Meta meaning beyond. So your tarsals of your foot, you have your navicular bone, you have your cuboidal or cuboid bone, and then you have your cuneiform bones. So you have a lateral, intermediate, and medial cuneiform bone. Here's your metatarsals, and then you actually have phalanges as well in your feet. Okay. So that's it for the bones and some of the ligaments that you'll find in the lower body. Hopefully this video helps to see it kind of like this, and we'll see you guys in the next video. All right, I just want to give credit where credit is due. These are the books and the resources I used for the videos. So first we have Essentials of Human Anatomy by Dr. Kurt Walker. We then have Essential Clinical Anatomy by Keith L. Moore and M.R. Auger and Arthur F. Daly. I also used Structure and Function of the Human Body by Mark Nielsen and Jamie Garbett. The last book I have is The Concise Book of Trigger Points by Simon Neil Asher. And then I used the app called Complete Anatomy. As you've seen from the videos, it's amazing. If you can afford it, I suggest it. It's such a useful tool when learning this stuff. So that's it. Have a good day.